Welsh Government.
This meeting is being recorded.
So as we said, the meeting's being recorded and we are going to make it available after the event the following week. And we're also going to share a link with you with all the PowerPoint presentations. So you don't need to take notes in respect of the slide decks because you will have access to those. So if you could keep your microphones on mute, please, and keep your cameras turned off for the duration of the event. We will switch the cameras on if delegates want to ask a question of the panel. So please get your questions ready and send them in through the chat function. Everybody will be able to see all the questions coming in on Zoom. And if we run out of time, because I'm sure there's going to be significant interest in what our speakers have to say, we will get back to everyone on email. And of course, please tweet about the event today and use the hashtag at #wellbeing4Wales to promote the very important conversation that we're going to start. So that's the introduction, and I'm going to open the webinar by asking Dr. Samina Azam, who's one of the senior leaders in Public Health Wales, very much an expert on this agenda, really to set the scene for us in terms of what is the context facing us now, Samina. Bore da, a drosodd i chi. Good morning, Samina, and over to you.
Thank you very much, Jan, and thank you for the opportunity to sort of come here and talk. And what I'm hoping is that if I help inform discussions later on today, I've got 4 main messages which I'll set out now. So the first one is housing is a determinant of health. The second one is housing cuts lives short. The third one is COVID has highlighted the impact of housing on inequalities. And the fourth one is cost of living has really made this issue more urgent. So there are so many ways of connecting health and housing. And this slide sort of illustrates just some of the ways that we can think of the 2 issues together. So for example, green homes, there's an opportunity there to improve the energy efficiency of homes, to make them more insulated. The quality of homes is incredibly important, particularly with regards to cold, damp housing. Functional homes, so we might have a good quality home, but it's not of much use if it doesn't suit the needs of the person living there. Neighbourhoods are incredibly important for homes. It's not just about the bricks and mortar, it's about the community in which you live. And finally, secure housing is key. There's nothing worse than worrying about being able to pay the bill, being able to pay your rent or your mortgage, being concerned about the roof over your head. Next slide, please. So this slide says an awful lot, but I'm going to just bring out some of the key messages. And it's from a World Health Organization report. And it's just basically saying that some of the gaps between the least and most deprived populations in Europe in self-reported health are due to living conditions. And most of those living conditions are actually due to housing deprivation, fuel deprivation, lack of green space, neighborhoods, overcrowding, and low air quality. And these are all things that are absolutely key to the health and housing agenda. Next slide. So looking at Wales more specifically, we know from data in Wales that nearly 1/5 of homes have got category 1 problems. So basically they pose unacceptable risks to health. And a lot of these are related to falls and cold housing. Each winter, a significant number of people die, more than we see for the rest of the year, related to the cold weather. And actually, we've got some of the worst excess winter death figures in Europe. And a lot of this is due to cold homes and also due to fuel poverty. Next slide, please. So the links between specifically cold and damp housing to health is fairly clear. Cold homes affect the cardiovascular, so that's the heart and the circulation system, the lungs. It affects the joints. It increases the risks of falls. But the other thing it does, which is equally important, is it reduces mental health and well-being. So that's incredibly important, and it's something that we mustn't forget. Next slide. Thank you. one of the things that we've learned from COVID is that houses are not just bricks and mortar or a roof. They're actually somewhere where we need to feel safe, secure. They need to be a home. And I just wanted to highlight a few things that have come out that I think are quite important during COVID. So firstly, one of my colleagues led on a report, which was a health impact assessment, looking at the home. And one of the key findings was that COVID has really highlighted the importance of good quality and affordable homes. We've all felt how important the home is for us during COVID. You know, being able to feel secure there, being able to have access to green space, that has been incredibly important during COVID times. The second thing is that during COVID, we've come to realize that not everybody feels safe and secure in their homes. There's been an increase in violence within the home, and this is something that has been termed a shadow pandemic. So it's something that's happened in parallel and alongside the COVID-19 infection. And violence within the home has affected women, children, minority populations. And one of the reasons that it's been called a shadow pandemic is because the data has been lacking a lot of the time. So it means that the issue hasn't really been visible and in the light. The final thing that has really been important during the pandemic is the security and tenure. So no fault evictions were extended from 2 months to 6 months, which brought a sense of security. That ended in March, but I do understand that there are plans for this to come back in December. Next slide, please. Now, we are very much living within a cost of living crisis, and all of us are being affected. And there isn't a single part of life that isn't affected by the cost of living crisis. So, and particularly in relation to housing. So here you can see that the cost of living crisis affects household debts, security, whether we can heat our own homes, whether we are able to afford food, the crowded nature of our homes. Basically, there is not one part of life that isn't affected. One of the key things that I wanted to highlight is that all of these issues that are affecting us aren't in isolation. They all interact and they all compound each other. Next slide. So inflation has been increasing recently, and the graph on the left is a summary of the CPI with housing included over the last 2 years. So that's the rate of inflation. And as you can see, it's really gone up recently. And it's been driven by three main things that I wanted to highlight. First of all was housing, so that's gas, electricity. Secondly, it's transport, so the cost of diesel, petrol. And thirdly, it's food. And these are all things that we have noticed. But the really concerning thing is that predictions are that these high inflation figures are set to last at least through to next year and not settle down for another 1.5 to 2 years. So what we see here are problems over the next couple of years, which are going to affect our most vulnerable populations and communities for the next couple of years. But actually, my concern is that this is going to be a public health issue for the longer term. One of the key figures that has come out very recently from Welsh Government, and that's a real cause of concern, is fuel poverty estimates. So if you look on the right-hand side, you'll see some really concerning figures about the number of households that are affected. And about half of households are estimated to be in fuel poverty at the moment, with North Wales particularly affected. Next slide, please. Thank you. So we've been thinking about health and housing for some years, our early work has very much focused on building the evidence, making the case for health and housing to work together, and also making the case for investing in housing so that we can improve health. So, for example, in 2019, we published a report called Making a Difference, Health and Housing. And this was very much about making the case for investing in housing with benefits to health and to wider society. So, for example, a couple of figures I just wanted to highlight. If you invest £1 in improving warmth in vulnerable populations, you then get £4 in health benefits. Another example, if you invest £1 in home adaptations, you get £7.50 back, saving for health and social care. So these are massive return on investments for which support society and support well-being. Next slide, please. So I think we're quite lucky in Wales in terms of our policy and legislation. It really provides a framework for collaboration, for not thinking about issues in isolation, for not thinking about our solutions in isolation, and it helps us work together. So the Wellbeing of Future Generations Act provides a platform for us to think about housing on a sustainable footing. The socioeconomic duty means that we have to think about our most disadvantaged communities in all our decision making. And I think that's so important, particularly with the current cost of living crisis. We have targets and ambitions in Wales with regards to net zero. And this is actually really key in terms of the cost of living crisis. And also it helps us think about, well, what can we do to improve homes, decarbonize them, but also have benefits for health? So a well-insulated home is also going to reduce the carbon footprint of the house, improve the warmth of the house, but also improve the health of the occupants. And finally, the Social Services and Wellbeing Act, I think, is really key, because what it's helped to do is, in the establishment of regional partnership boards, is given housing a seat at the table. And I think that's really important when it comes to key decisions. Next slide, please. So we've been doing a bit of reflecting post-COVID about how we move forward, how we as a team in Public Health Wales support the health and housing agenda. And we've been talking to partner organisations and colleagues. And one of the things that we've been hearing is that actually there's a lot of evidence out there in terms of the importance of health and housing. And what we need to do is perhaps move to a position where we're supporting the implementation, supporting the collaboration, helping join the dots. I just wanted to flag that one of our colleagues, Gareth Morgan, who works in Haldar Health Board, has actually started to do this. And I really wanted to make a plug for his work. He's been awarded a Bevan Exemplar. And basically what he's done is set up a community of practice for health and housing. And he's also developing a good practice guide for NHS Wales. And that helps NHS organisations to understand how they're connecting to the housing sector, to assess how they're doing, and also to open up a conversation. And I think this is fantastic work. Gareth was really keen that if anybody's interested, they get in touch with him. So his email is on the slide. So that is actually my last slide, I think, luckily. But just to reiterate my key points, housing is absolutely a key determinant of health. It is a matter of life and death. COVID has really highlighted the importance of housing in terms of inequalities, and the cost of living crisis has made the situation far more urgent. Thank you.
Thank you, Diolch yn fawr, Samina. Thank you very much, Samina, for getting the webinar off to such a strong, powerful start. A very, very sobering context there from you, but it's quite clear that everything is connected, and your cost of living slide is so powerful in terms of the fact, as you say, no one is unaffected, and vulnerable groups, vulnerable communities are really very, very much affected, and housing is very much at the centre of that. So got us off to a really strong start. Now, I do know, Samina, that we do have a lot of references, don't we, in terms of the work that you've referred to. So if we can, I think there is a slide that puts the references together. If you can include that, then the Confederation team can circulate that. But diolch yn fawr am eich amser eto bore heddiw. Thank you very much again for your time this morning, Samina. So gawn ni troi Sarah Scotcher. We'll turn now to Sarah Scotcher, who's the Policy and External Affairs Manager from Community Housing Cymru. Bore da, Sarah, croeso.
Morning, everyone. Thanks, Jan. Thanks, Samina. And excuse my voice, which is a little bit gravelly this morning. I'm just going to share my screen, hopefully. Oh, I'm not able to right now. It might be that the team at Confed needs to just double check that for me. so I'm not currently able to, but a lot of my presentation will inevitably mirror what Samina's gone through just now, and the really close relationship that I think a lot of people are aware of, but has really been brought to the fore between housing and health over the last couple of years, and we have some real opportunities. Bear with us just a moment, everyone. Thank you. Yes, please, Nesta. Thank you. Okay. There we go. Thank you, everyone, for bearing with us a sec. That's fab. So yes, my name's Sarah Scott-Jones. It's great to be here. Thank you for having me. And I'll be talking about how housing associations, social landlords, independent social landlords are playing our part in tackling these really, really important health inequalities. So on to the first slide, please. Right, so I won't repeat all the evidence Samina summarised so effectively, but I wanted just to reflect on the fact that it's a two-way process. So it's not just that housing affects your health and your life chances, it's that actually other inequalities, societal ones and health ones, affect the type of housing that you can access. So it might be that you can't access the good quality adapted housing in the first place to be able to support your physical or mental health, let alone that the type of housing you are living in then really does have an impact on all the things Samina talks about, respiratory conditions, falls. And we know that adaptations are one of the best in terms of return on investment and speed of return on investment when it comes to preventative measures, fuel poverty, which we're acutely aware of, and in fact, access to services and amenities, health services, and even just the shops that aren't too expensive. That's a huge, huge impact on living conditions and quality of life. Next slide, please. Thank you. So just in case you're not familiar with the sector, housing associations, also known as registered social landlords, there's around about 36 in Wales, all shapes and sizes, some very big with a huge amount of general needs stock based in cities, and some much, much smaller and focused on specialist services for veterans or people with learning disabilities and so on. So it's a real diverse and broad sector, which is fantastic, and a wealth of experience and skill and knowledge there. Independent social businesses regulated by the Welsh Government, the housing side, provide almost 165,000 homes to 10% of the Welsh population. So it's quite a big contribution to the rental sector. And general needs homes, so for people who don't have additional needs, basically, supported and specialist accommodation, homelessness prevention, so important, and care and support services, a minority of which are registered. So those would be registered and regulated care inspectorate Wales. So a huge contribution also, not just on the wider preventative health side, but also to social care provision itself. Next slide, please. Thank you. And as Samina said, it goes beyond bricks and mortar. It's very important, of course, that investing in good quality homes so that people can be healthier and live independently for longer in those homes that are appropriate. But also housing associations have a key role to play in closing the health and wellbeing equality gaps by supporting their tenants with their personal, their social and their financial health and wellbeing. So, for example, promoting independence through care and support for older people, people with disabilities and other needs, addressing and reducing the inequality with income maximisation support, financial resilience, digital inclusion and homelessness prevention. And a lot of that starts at the very beginning, giving someone a home that is suitable for them and that they can afford, setting that person up for success in a sustainable tenancy. So they are far less likely to run into trouble down the road and be at risk of homelessness. Resources and relationships is a big one. So loaning knowledge from the housing association who is embedded in their community, loaning those insights so that we can amplify our partners' efforts and bridge the gap between public services and communities. Got an example of that later in the presentation. And then the big picture, Samina mentioned the RPBs, I'm sure everyone's very familiar with them. playing our part and contributing everything we can to those strategic bodies to make really long-term shifts towards prevention and not just crisis response. Next slide, please. So an example of working with partners to really make a difference at a local level is increasing vaccine take-up in Butetown. So this was in June 2021 when the huge efforts to roll out vaccination were really kicking up. So Butetown is an ethnically diverse area and they are quite high levels of deprivation in places there. And there's a concern in the community and in partners there about a lower take-up of vaccine among residents. So Cardiff Community HA, so that's CCHA, hosted a 2-day pop-up vaccination centre in the local community. So they worked with the Ludon Health Centre based there, Muslim Doctors Cymru, local community leaders, and also the team at Cardiff and Vale Health Board. And they provided the local space and staff, communication channels with residents because they are already connected to those communities and understand those communities, and social media and the reach there and the logistics and the booking systems. So there's a lot of capacity and resource and insights there that can be loaned to bridge any existing gap for whatever reason between, for example, the health service and the community that needs support in a particular area. So that's just one of many examples. Next slide, please. RPB's massive part of the jigsaw and one that we're still probably tapping into the potential of, I think. So we know that the partners include health, social care, housing, third sector, and of course carers and cared for people reps to make sure we actually have lived experience informing that. And housing associations weren't originally in the compulsory official membership. That happened more recently, but that has allowed a real opening of discussion to housing and to social housing as part of this equation. So there's contribution to and shaping of plans, population needs assessments, regional area plans, and of course market stability reports, which will make for very interesting reading, I'm sure, over the coming months. Key opportunities. We've got the Integrated Care Fund's successes in the Regional Integrated Fund and the Housing with Care Fund, among others. And we can really shift the spending profile if we do this right towards prevention, which we know is a far better return on investment, but very difficult in the times that we've been living and operating. And partnership structures are large and complex, and there are many different subgroups and committees. And it's important that the conversations really make the most of the expertise in the room and the relationships and structures work together so that housing can be more than peripheral, which is as RPBs find their feet and develop in their relationships and their structures, that's a key opportunity. And next slide, please. And the cost of living crisis again, so means referred to it, it's all on our minds and quite rightly. So on the ground, housing associations, they always have done and they always will provide services for people's financial well-being for their tenants. And that includes income maximisation and accessing all the benefits they're entitled to, managing any debt or arrears they might have. And there's been a real flexibility and willingness to work together over the last couple of years between tenants and their social landlords. But especially important at the moment, energy advice services. Hardship funds, and we're talking quite a lot of money being provided, hardship funds for immediate relief in those emergency situations where things have got really, really quite acute. Community fridges and food banks, sadly ever in demand, and working with partners in the public and third sector, whether that's referring or working together on projects at a local level or whatever. And we at CHC, as the representative body for housing associations, we've been working with members and with partners to think about our lobbying asks of UK and Welsh Government. So we're asking to extend, simplify and redirect the crisis funding to reduce tenant arrears debt. There's quite a few different pots of relief dotted around and they're not always the easiest to navigate and to access on behalf of tenants or by tenants directly. Provide more funding direct to the HAs themselves who can get the money to the tenants faster, just to cut out any unnecessary barriers for people who need to navigate these routes and pathways. and reduce and prevent the energy debt now and during the winter. And we've been working also at CHC with Gareth Morgan-Hulda and his fantastic work as we come into the winter. Next slide, please. I think that might be it from me. So thank you so much for your time and your attention. That is just a snapshot really of what's going on in the sector. I'll pop a link in the chat, if I may, of a briefing we put together that expands on some of this stuff. And I'm always happy to talk anyone's ear off about it. But I'll leave it there because I know we've got the other speakers coming up. Really looking forward to hearing them. Thanks, Jan.
Thank you. Diolch yn fawr, Sarah. Thank you very much for that real insight into the role that housing associations can play and the importance of, you know, well-developed integrated community housing approaches to help individuals, families and communities. And I was very struck by your comments on return of investment, Sarah, and how small adaptations, small changes can make such a difference. And of course, we do know currently that there are a number of people in hospital currently whose health and well-being is being impacted adversely because they can't access the specialist housing or accommodation they need to leave hospital, and that's having such a big impact on them. But your ideas for how we can actually tackle the cost of living crisis, practical ideas, and help to shift the spend to prevention is, I'm sure, something we'll come back to. Sarah, diolch yn fawr. In cyflwyno'r nesaf yw Joe Oak. Now, our next presenter is Joe Oak, who is the Chief Executive Officer of Valleys to Coast Housing Association. So, bore da, Joe, and drosodd i hi. Good morning, Joe, and over to you, please, for your contribution.
Oh, thanks, Jan. Bore da. I'm Joe Oak, Chief Executive of Valleys to Coast. I'm not sure, I'm just going to check with Nesta whether you can see me, because I can't turn my camera on from my end. It's not allowing me to, but I will continue because I know we're up against with time. But it's great to be here and thank you for inviting me to discuss the benefits of working in partnership for better health and wellbeing outcomes. So if I could just move on a little to the next slide, please. Just a little bit about Valleys to Coast. So we're a registered social landlord, a not-for-profit organisation, and we operate within the Bridgend County Borough area, just under 6,000 properties, 7 sheltered scheme, 1 extra care scheme, and you'll see there we've just got a kind of small portfolio of shops, flats and garages. So next slide, please. As you know, we'd already heard from Samina and Sarah, you know, there's well-established evidence that says good quality housing is critical to better health outcomes. You know, a well-housed population reduces delayed demand for NHS services, you know, and allow patients to go home when they're clinically fit to do so. In the King's Fund report, it's estimated the cost of poor housing to the NHS is 1.4 billion per year. Now, we heard in terms of Samina that investment and what the savings could be made if we invested in homes and what savings could be made to the public purse. And where health and housing have come together, the focus has often been around keeping people living independently at their home and supporting timely discharge from hospital. And, you know, this is really important and, you know, we know that this is vital, but what's also important, what we hear, is ensuring that we've got a good supply of good quality homes. And I'll come back onto that a little bit later. Next slide. What I just want to talk through is just to put into some of the context of what's already happening and what we're doing in Valleys to Coast and what's happening across the sector, because there is a lot of good practice happening. And yesterday I was in a ministerial spotlight session with Julie Morgan, where a number of RSLs were sharing best practice across Wales and demonstrating the importance of working in partnership. So the momentum is really building. So I just want to share a few case studies to start really illustrating these examples of what we're doing and the factors that contribute to success. So the first case study I'm just going to highlight is around the timely discharge and community rehabilitation. So this case study is improving a partnership approach that we already had with the NHS, and we wanted to ensure that it was just more coordinated end-to-end discharge process to improve the rehabilitation and the mental well-being. So a little bit of a background really is we have a customer who was age 62, had been living in one of our Valleys to Coast properties for 10 years. And the customer had a strong community network, but there was a social isolation and some mental health issues areas for this customer. And the customer was admitted to hospital following a stroke, and they were taken they had the support of the community care team. Now, prior to discharge, the usual step would have been taken. The NHS then would ensure a safe discharge from a clinical perspective. We wanted to ensure that we were extending this support and widening the scope of the discharge through a multidisciplinary approach. So we engaged with the following services of social services, the community care services, there was ourselves, the floating support team, which was Sycamore at the time, involving the customer and their family members, the care coordinators from the hospital discharge team, and Age Connect. And the integrated person-centred approach ensured continuity support from hospital discharge to community rehabilitation, and making sure that there was a smooth transition, that we wanted to maximise the independence, reduce social isolation, and ensure that there was a necessary hospital stay. And working in this way ensured the customer was referred to the appropriate services at the appropriate time at the point of discharge. We was ensuring then there was appropriate financial support. We wanted to avoid any financial distress, all of these which would hinder the rehabilitation of the individual. So us as a landlord, we were able to work with the occupational therapy team and social services to consider their home environment, to make sure it was compliant, so it was warm, it was safe before they returned to home. We assessed any accessibility issues, and whilst previously this would have happened, but it would have been at the point when the customer returned to home, and potentially would have been at a point when there could have been still some crises happening. So the outcome of this approach, the customer when they were discharged and having this real preventative home first approach, meant that the customer fed back that they had a feeling of increased speed in their recovery, there was an improvement in their mental health, and they felt supported in all areas of life. And support they said they could previously wouldn't have asked help for, but now are willing to ask help for in the future. The partnership of this fed back that they've seen much improved means of communication, a much more successful approach to planning beyond the hospital discharge. There were some innovative approaches and a noticeable difference in the relationship and communication between the patient and all the services. But also what's really interesting was that all the support services came back to say this gave them real insight and understanding of what each other was able to offer. And for us as a landlord and housing association, we was able to ensure that that property was fit for purpose before the customer returned. Adaptations were completed prior to the return, and that we were able then to continue to have those conversations, the relationship with the customer, to bring in any necessary support that was required. And what, as we discussed the importance then, all the compliance, that individual had a safe, warm home in terms of continuing. We worked with Age Cymru to do some cost benefit analysis and return on investment, and the customers rehabilitation programme lasted 12 weeks. And if we took our normal approach rather than multidisciplinary, this would have been a cost of just under 30,000 for the NHS. And taking this much more multidisciplinary home first approach costed just under 13,000. So we can see, even though there's this intensive resource around, actually has a saving, overall saving to the public purse. So the successes here are about planned coordinated approaches, being collaboratively project managed, and ultimately what this derives is better outcomes for the individual. Other case studies that we've been doing as well in terms of the wider partnership is that taking a real person-centred approach, that real tenant-led to improving well-being through designing digital solutions for the health and well-being for customers. And we've been working with Bridgend College and Cardiff University to measure, and it is the actual customers who are designing the services to improve their health being. And I'm conscious of time, so move on to the next slide in terms of, you know, what we will need to do and continue to do more of, and what are those opportunities. So it's saying there's great good practice that's happening, but we do need scale and depth. The multidisciplinary approach, you know, it is hard, it takes planning, and it does take coordination, and those partnerships need to go beyond health and social care. So it's great to see that the population needs assessment includes housing need. We've already just signed off a really exciting opportunity to be at the forefront of transformational change in the Cwm Taf Morgannwg University Health Board, where we have got a joint post which will be working closely between health, housing, care and the community to develop and deliver coherent evidence-based programme of actions and activities around health and housing. And as I mentioned, you know, it's not just about kind of just all those wraparound services. You know, it all starts with individuals feeling that they have their own front door, a home that they can feel safe and happy. And we know there is a shortage of good, affordable housing. So we need to be thinking differently about how we can free up land to build the much needed homes. And just to summarise, and on my last bullet point, is that we need to think big. Solutions need to go beyond our organisational boundaries and financial constraints. We need to see and evidence wider social value and the greater benefit to the public purse. So diolch yn fawr, thank you.
Diolch yn fawr, Joe. And again, very, very powerful presentation, and really a very rich case study in learning in respect to the practical steps that can be taken by partners to build connections and really enable change for the better for people. Return of investment came up again as a very, very key theme. And how can we optimize the resources that we have? And what are the priorities for collaboration to do so? I think that came across to me clearly as well. Now, gawn ni troi Ross Thomas. We're now going to turn to Ross Thomas from Tai Pawb. Ross is the head of policy and public affairs. Croeso, Ross, drosodd i chi. Welcome, Ross, and over to you.
Bore da, Jan, thanks very much. Good morning, and diolch yn fawr iawn am y gwahoddiad. Thanks so much for the invitation to speak this morning. As Jan has mentioned, Ross Thomas, Head of Policy and Public Affairs at Tai Pawb. I'm absolutely ashamed I haven't branded my presentation throughout like other speakers have, but I've got no one else to blame other than myself because I'm actually head of branding, so I'll have a word with myself later. For those of you who are unaware of us, Tai Pawb is Wales's housing and equalities charity. So we work with housing providers as a membership body to improve all aspects of equality, diversity and inclusion. Together with CIH Cymru and Shelter Cymru, we are leading on Back the Bill, the right to a good home. It's a cross-sector call for Welsh Government to introduce a legal right to housing here in Wales. A big thanks to the previous speakers. I'm not sure if it was deliberate that myself and the right to housing presentation were last up, but it's really actually very helpful in shaping the argument, and it's great to see the synergy between all presentations. We've heard lots of facts and figures, information, good practice. A question that comes to my mind, I think, how do we bake in all that good practice and ensure that what we've heard already is business as usual stuff across Wales? My answer, perhaps unsurprisingly, is to embed a legal right to housing in legislation. Next slide, please. I think you've got to click and the next bit as well. Fab, great. So I don't propose teaching you to suck eggs. Some of you may already know a little bit about the campaign, but essentially the legislation is centred on a UN covenant, and it's for us in Wales to opt in and adopt it as part of the legislation landscape. The actual term under the UN is adequate housing. I don't think anybody likes that word. I absolutely hate it. What we really mean is good quality housing. And the really important aspect of introducing that good quality housing is progressive realisation. So when we first began the campaign, the fear among stakeholders was that it just wasn't doable. We don't have the capacity or the resources, and it would mean bankruptcy essentially. Housing providers in particular were concerned that it meant on day one of the right being introduced that it could mean a queue outside the office door of tenants and others demanding their right to housing. So let's be absolutely clear before we begin, that's a myth. Something as fundamental a change as this would need to be realised over time progressively. So what we're saying is that Welsh Government would need to afford the policy maximum available resources over time. In practice, that means that the actual right develops over time, and an individual's right to adequate housing would also develop over time and would look very different, for example, in year 1 to year 5 to year 10, as further homes are built, homes that are primarily fit for purpose and take account of people's requirements. Next slide. Yeah, there are 7 on this bit. That's fab. So really quickly on this bit, 7 components to the right to adequate housing. I'm not going to bore you on this. So in practice and drilling down, what does that mean? That means a safe, secure, affordable and good quality home that takes account of your needs, that's in the right place and with access to local facilities. Next slide, please. So a really potted history of the campaign. We published a comprehensive feasibility study in 2019 that kicked off the conversation about what vision we have in Wales for housing and human rights moving forward. That looked particularly at ways that we could tackle homelessness, the disability housing crisis, and affordability through legislation as a mechanism. Directly from that, we derived a draft bill, and the key word here is draft. It is absolutely in draft, which sets out what the legislation might look like in practice, imposing a duty on ministers, for example, to budget for building more homes and for housing improvements, and really importantly, holding them accountable on that legislation. Fast forward to October 2021 and the publication of the cooperation agreement between Welsh Labour and Plaid. And there is a commitment to a white paper that explores the introduction of the right to adequate housing in Wales, alongside many other housing commitments such as ending homelessness and potentially rent controls as well. The most exciting part for us has been the securing of external funds via the Oak Foundation to help us take that feasibility study to the next level so that we have some tangible outcomes. Next slide, please. And if we skip slide 5, because I'm just conscious of time, I can chat about phase 1 on a further slide. So housing inequality. Okay, so we're into the roots of the issue now. These next 2 slides are about the why of the right to adequate housing, recognising the inequality that exists across Wales has already been mentioned in previous presentations. I've just selected a handful of stats against some protected characteristics here. Perhaps no surprise that a significant number of homes have hazards, given that Wales has some of the oldest housing stock in Western Europe. At that cost of retrofitting and a mix of global inflation crisis, resources are really, really thin on the ground. And traditionally, we've talked about cold and damp homes in the winter, but the conversation will increasingly need to be about homes that take account of a much warmer climate too. Just think of last weekend and the coming weekend and next week, where temperatures are expected to be widely 30 plus. We're also still living with the legacy of having rightly supported people off the streets during the pandemic and into temporary accommodation. But in too many cases, there just isn't currently an option to move them on into a sustainable setting. Further, Black, Asian and minority ethnic people find themselves at risk of living in overcrowded conditions, in particular as a result of intergenerational living. And meanwhile, a quarter of people in Wales report having some form of disability. This rises to a third in social housing. And in some of the worst cases, anecdotally, we're aware of disabled tenants who have had to be carried up and down the stairs in the morning and of an evening for a period of years because of a lack of accessible housing in their local area. Many of whom have found themselves in hospital a lot longer than necessary because their home is a hazard to them. So not only do we have a general housing crisis, we have crises within a crisis, a huge shortage of accessible homes, for example. Increasingly, homes are unaffordable, and as the population of Wales changes, so too do our needs within a home, but many homes are just not fit for purpose. Next slide, please. So this is another why slide, why we need to take the action that we need to take. I've highlighted the health issues in bold. Some of them have already been discussed by previous speakers, but I think most of us might recognise there is a significant cost to poor and inadequate housing, and this really lays it out bare at £1 billion. Meanwhile, the 95 million figure would only take account of those presenting in primary or secondary care, for example. And there is a huge hidden cost, not least in mental health or for those whose health deteriorates gradually in their own home. And again, considering Wales has some really old housing stock, older people in particular are at risk of falls because of hazards in their property, which can be prevented. Ultimately, all of this is preventable. Next slide, please. So just touching really quickly on phase 1 of the research, this was in essence an international comparator exercise, looking at where the right to adequate housing was being progressed and what achievements there had been. Took in 7 different countries. Interestingly, what we tended to find was that where there was funding and resource made available for housing, the necessary legislation and mechanisms weren't in place to put things right. On the flip side, in some countries, the legislation and mechanisms were in place, but the resource wasn't available, and therefore expanding the housing stock just wasn't a priority. Finland, perhaps unsurprisingly, lots of us will know Finland as an example, with its war on homelessness, that stood out. Some interviews with Finnish government officials, for example, describe how homelessness is effectively an antithesis in the Finnish psyche, and I think that's really soaking through into the Welsh psyche now as well. Next slide, please. So what did we learn from looking globally? Absolutely, progressive realisation is the best way of achieving the right to adequate housing, probably the only and effective way. It doesn't happen overnight, so don't panic, but lots of people would like it to happen overnight nonetheless. It's a huge cultural shift in the way we do things, and in some respects will require the stars to align, for want of a better phrase, but I'm absolutely confident that a forward-looking Wales can get there. It also told us that governance is key, but balanced governance, so it's all the more critical. That means that we work together to ensure that we were building the right number of homes in the right places, the right style of homes, with the right adaptations as well, in order that we actually realise the right for individuals without them having to challenge for it. This is far more carrot than it ever should be stick. Given that there was no one way of introducing and realising the right to adequate housing, it gives us here in Wales an opportunity to do it the Welsh way, learning from our own circumstances and potentially becoming a world leader in basing housing in a human rights framework. Next slide, please. And this is my last. So we're just about to wrap up on phase 2 of the research, which is being conducted on our behalf by Alma Economics, well known in Wales for cost-benefit analyses. We have a draft with us at the moment, which we're about to sign off on. And while I can't share the details with you, it mightn't come as a surprise to any of us to learn that the cost-benefit figures are looking really promising. We were confident that while there is an upfront cost, absolutely, it's outweighed substantially by the benefits. It's genuinely once in a generation opportunity to invest, to save, and to be pragmatic, again, in the realms of progressive realisation. We're looking at this over a 30-year period. Essentially, what do we want housing in Wales to look like post-2050? What we don't want this to be is an extra layer of legislation, further reporting, further cost, further issues of capacity. What it can be in reality, if it's worked properly, is a bagging up or a tidying up exercise of lots of the different pieces of work ongoing in housing at the moment and across the policy spectrum, be that in health, decarb, retrofit through housing standards. It's a huge opportunity. And I'll finish today's presentation with something of a rhetorical question. Can we afford not to do this? I think I know the answer, and I hope others agree with me too. Thanks very much, Jan. Diolch yn fawr iawn.
Thank you. Diolch yn fawr eto, Ross. Thank you very much, Ross, for actually outlining for us so clearly the key campaigning and influencing work that Tai Pawb has underway currently, including the right to the good home, the right to an adequate home campaign. And I'm sure we're going to come back to that in our questioning. Well, we've had 4 very powerful presentations, rich in learning, rich in total understanding of the public health emergency that is the housing crisis in Wales, and within that, a housing crisis for particular different groups of the population. And we've got some comments in the chat bar around that I'm sure we'll come to. Now, it's your opportunity to actually ask questions of our panel. Samina hasn't been able to stay with us, but I'm delighted to say that Ross, Sarah and Joe are with us, and your questions are coming in. I'm going to begin by one that's in the sidebar, and it comes from Sandra Newport, and she's referencing comments that Martin Lewis has made, suggesting that we are going to need health banks this coming winter because people simply won't be able to afford to heat their home and stay in their home, and they'll need somewhere to stay safe. So do panel members think that this is really going to be a reality? Is it going to become this stark and this much of an emergency? Sarah, shall I perhaps ask you for your thoughts on that first, please?
Thanks, Jan. And it's an interesting question. And yeah, it's stark. It really does bring to sharp relief the situation we're in if we're considering this sort of thing. I don't know whether it will become a reality. I unfortunately can't see that it wouldn't. I can't see a reason why it wouldn't if the need is there. Because there's all sorts of things that people find in their homes, safety, warmth or cool. And not everyone has that reliably at home, just like they can't reliably afford to eat nutritious food and so on. So I certainly hope we don't get to that point, but I also hope that if there's a need for it, then people can access what it is that they need to stay healthy and safe at the basic level, isn't it? So I don't know. I hope not.
Yeah, thank you, Sarah. Jo, what's your thinking on this?
You know, aligned with Sarah, you know, you would hope that this wouldn't become a reality, but you know what we are hearing is, you know, we're hearing these phrases, you know, people making those basic decisions, saying whether they're going to eat or heat. You know, in terms of where we currently are, is those basic decisions is quite, you know, extraordinary to think that that's what families and individuals are faced with. And you know, we are going into a crisis. As we're going into the winter period, you know, there are things we want to try and do and support. You know, a number of RSLs have many advice teams to try and encourage and help and signpost it to address those financial issues. There are, you know, RSLs have got a programme of where we're trying to make homes as energy efficient as possible. But we know those solutions are not going to be overnight solutions. So, and it's a bit, we can think longer term to not go there, but you know, we are heading for that winter crisis.
Thank you, Jo. I think this is going to be one of the very powerful messages we want to send into government, isn't it, from today? So Ross, what are your thoughts adding to what Sarah and Jo have commented on there?
Yeah, thanks, Jan. I absolutely agree with both Sarah and Jo. Really hope we don't get to it to that point. Would it surprise me particularly? No, because I think the prospects, certainly economically, and the impact then on health and other aspects of people's lives over the next 12, 18 months, possibly 2 years, is bleak. We're heading towards a recession as well. I know there's a robust debate always when we come to these crises around targeted and universal support, and I know Welsh Government has been pretty clear in setting up some universal support, but also targeted support as well. I think there is a job of work to be done there around targeting that support. Whenever these crises rear their heads, it's always those who are least able to shoulder that burden who are always the worst impacted, and we're talking about protected characteristics. We're talking, you know, right across the spectrum, really. So targeted support, I think, from local authorities, possibly with the support of RSLs in terms of delivery partners, but certainly from Welsh Government and further up the chain, UK Government, who ultimately hold the purse strings. I think that could be something that we look at.
Thank you. Thank you very much, Ross. And to our three panel members there, clearly a very powerful message that we want to put into government. And Nesta, I know that you are going to pull the areas of questioning, the themes coming through together. So if we can log that one, please. Now, we've had one in from the MS Society Cymru, who tell us that they've heard worrying reports from some people living with MS who are in private rental properties, that their rent has significantly increased, and their landlords have attributed this to the impending changes of the Renting Homes Wales Act and the changes that will bring. Now, are our panel members aware of this? And what is the support out there for people who simply can't afford these types of rent increases? So Ross, shall I come back to you and start with you on that one then? What's your understanding of this position?
Yeah, thanks, Jan. Yeah, obviously, members on the call today may be aware that the Renting Homes Amendment Act is due to come in December this year. It's been deferred for a further 6 months. And there is perhaps a fear that many private landlords are either going to up their rents or leave the market entirely. This is where I make a call, essentially, and I know it doesn't necessarily solve the problem for those individuals in the here and now. For more social housing, it's absolutely key that we work together with delivery partners through Welsh Government to provide more social housing that's affordable, it's in the right place, and it suits people's needs. that doesn't solve their problem at this moment in time. I would encourage those people to reach out to the likes of Rent Smart Wales, if it's possible, to have that conversation, an open conversation with their private landlord. Obviously, that may not be fruitful, but in the longer run, the more social homes we have, the better it is for the Welsh population in terms of not necessarily being a victim of spiked rents.
Thank you. That's a really important point there, Ross. Joe, your comments on this whole question of rent increases and the impact that has.
Yeah, I support Ross's point here in terms of, and as I said, we know that there is a shortage of affordable homes in Wales, and we need to really address that. You know, Renting Homes Act is coming in to give more rights to customers for improved standards. You know, so, and they are passing the cost back to that customer in that private landlord situation, but they should not be living in some of the standards that we've seen the private landlords allow. You know, we've been talking about the importance of good quality homes and the benefits that have on individuals' outcomes, on their health and their well-being outcomes. So it's definitely the right direction for having this legislation in place. Haven't got the solutions in terms of landlords increasing, but you know what's underneath it and the spirit of that legislation is the right direction. But some of that solution needs to be, we need to be able to address the shortage of social housing in Wales.
Thank you. And of course, some of these things have unintended consequences, don't they? As Ross was indicating, and it's really important that we don't see those unintended consequences coming into play. Sarah, would you like to add to the panel's comments on this?
Thanks, and yeah, absolutely agree with previous comments. And the Renting Homes Act is something that we at CHC have been doing a lot of work on, because it's a massive change for the better. It's been a long time coming, and it's a huge amount of work for landlords, and especially those landlords with a lot of homes, social landlords, local authorities, as well as housing associations. It's interesting the fears and claims coming from the private rented sector. I think that there is a sense of alarm, if I'm honest, in the sector, which is, you've had Rent Smart Wales in place for a few years, so that's placed extra sort of obligations and duties on private sector landlords, which probably for the majority of good quality private rented sector landlords hasn't changed the reality a whole lot, because they were already doing most of the right things. But for those tenants in homes that aren't of a decent quality, that standard raising is really important. And the Renting Homes Act is just another tool that we can use to make sure that people have a way to assure themselves of those rights, and recourse for those rights. As Ross said, the answer, and I would say this, is more social housing, more affordable housing, so that there isn't so much pressure on the private rented sector. That means that those rents can be increased because someone will pay them if they're desperate enough and if they're able to, sometimes at risk of other financial obligations they have. We know that debt levels are absolutely devastating for some people at the moment. So my hope is that the PRS are able to, landlords are able to better understand what the act means for them, because I think that sense of alarm sometimes exacerbates the knee-jerk reaction of, oh no, rents are going to go up, and oh no, they are going to leave the market, when actually I'm not sure we've seen evidence of PRS landlords leaving in particular numbers yet. And that may happen, and it may be an unintended consequence. And the answer is make sure that housing is there, that affordable housing is there.
Thank you very much, Sarah. And we have a number of comments coming in now. And we did say that if the audience participants wanted to engage with the panel, that was very welcome. And Viv Harpwood has put something around the Renters Reform Bill. Viv, would you like to come in at that point and actually talk with the panel on the issue you've raised there?
Yes, if I can get my, can you hear me?
Yes, we can.
Right, it's really, I know this is new, and I know it's in England and housing is devolved. So I just wondered what the differences are between this proposed, and this has been proposed since, believe it or not, Theresa May's time, Tory government in England have produced this very interesting renters reform bill, and with all sorts of things in it, including some of the things that we have in Wales. But I don't really know what Wales is doing differently when it comes in. And remember, it was introduced, that Renting Homes Act, in 2016. You know, what will the differences be? Will renters in England have a better deal than those in Wales?
Thank you, Viv. So, Ross, can you comment on that at all in terms of what the differences might be? Because as we understand it, this is about trying to remove short-term tenancy agreements, is it, and introduce a basic decent home standard?
But it does other things as well. You know, it's got this standard, a decent home standard, and it deals with things like allowing people who rent to have pets. You know, stop landlords discriminating against people on benefit or people with children. And even if you look at what the courts are doing in housing law cases, they very much seem to be on the side of the landlord, partly because of the current legislation, but partly because there is, I don't know, a kind of bias. I won't say any more. You know, what I would love to know is, I haven't sat down and looked at the differences between the two pieces of legislation, a proposed legislation in England. I mean, it's only a white paper, it's only a bill at the moment.
Right. Okay. Thank you, Viv. Thanks for that clarification. Ross, any comments on that?
Yeah, just very briefly, there are quite a few crossovers between the two pieces of legislation. I think one of the key things, particularly for tenants, with regards to the Renting Homes Amendment Act, is the fitness for human habitation test, which obviously will allow tenants effectively to hold their housing providers accountable. What I think is key here is that good quality housing comes together through a partnership. That's a partnership between tenants, and also it's a partnership between the housing provider as well. I think there needs to be an understanding absolutely there. The fitness for human habitation test would be certainly an interesting one, but there are so many mechanisms to allow us to get to that. So, for example, Welsh Government is out to consultation at the moment on its 2023 Welsh Housing Quality Standard. That's where RSLs and other housing providers will be working with the Welsh Government to ensure that there is long-term investment in ensuring that what is the oldest housing stock in Wales, in Western Europe, broadly speaking, is brought up to that standard. So there certainly is a lot of crossover. It'll be interesting to see what the difference will be between the two as they're both implemented, really.
Thank you, Ross. Sarah, anything from your perspective on this?
Thanks, Janet, and thank you for the question. It is an interesting one because while the Renters Reform Bill has been a few years in the making, of course, it's been a little bit longer for the Renting Homes Act. And my gut instinct here is the devil's in the detail, because the Renting Homes Act has taken a little while, not least because it's hugely complex, and as we go along, new things come to light and need to be addressed to make sure that it works proportionally and fairly for everyone and doesn't cause more problems along the way. And it's a huge amount of work when you've got other priorities on. So I think it will be very interesting to see whether these proposals that have been sort of sketched out translate into and what we get at the final step. And raising standards, as Ross says, in Wales, you've got WHQS 2.0 for some people who have been involved in the previous WHQS, with a huge focus now on decarb. And also, I think in 2021, there was the Welsh design quality requirements as well, to do with how social homes are designed and developed. So we do have lots of mechanisms, particularly on the social housing side. And the fitness for human habitation, I think, supports more on the private side too. So yes, it will be very interesting to see what comes out the other end.
Thank you. And Jo, please, your comments on that.
Thank you, Jan. Well, it's just to reiterate, really, I think I haven't done a like-for-like comparison, but I think in terms of Ross saying, in Wales, what we've got is a number of different kind of policy and legislation. So we've got the Renting Home Wales Act, we've got the out for consultation now, which is the Welsh Housing Quality Standards 2. driving it. And there's alignment between what's in Renting Homes Act and what's in the WHQS too. And these are about longer term to, raise standards, but to be addressing things like fuel poverty, water poverty, address digital inclusion, all of those. So that Sarah's point about the devil being in the detail is that you need to really unpick all of these and understand how all of these are contributing. And in Wales, since the pandemic, a number of RSLs were doing it pre-pandemic in terms of a no evictions policy as well. So it's these things which are really important for us to continue.
Yeah, thank you. Some very, very powerful messages there, which we will capture as part of messages coming from this webinar this morning. Now, we've had a question in from Shelter, just to say that, sadly, we all know the links between housing and health very well, and they've been set out for us so clearly today. But what, in the panel's view, are the blockers and the enablers from getting where we are now to where we actually want to be and need to be? So, Jo, shall I come back to you and start on that one? The blockers and the enablers, do you think, the key things?
Yeah, I think what we have here today, and what I set out certainly, was that there is real momentum of that partnership working. I think what has been some of the blockers previously have been kind of organisational boundaries, as what's got in the way, and really trying to strengthen the partnership working. The case study that I shared was very much around, if you have that multidisciplinary approach, that those services really understand how each other operate, that real early planning. So they're the real enablers, and knowing the difference that can make in terms of the benefit to the public purse. We've all been focused on trying to, what are the efficiencies we need to be delivering or improving, but within our own service areas. And it's us thinking much beyond that and seeing the bigger picture here about, if we all contribute and understand, we have better outcomes for individuals, but there's that better understanding of how we can all play in terms of delivering our services and coming together, really early adoption. Because I think we all know that the services are, critical, crisis in terms of coming out of the pandemic. It's so easy to try and continue and be in that very reactive mode. But we know if we're able just to lift our heads above the parapet, really to have those early engaging conversations, actually you do deliver better outcomes in a much more affordable and efficient way.
Yeah, thank you, Jo. And you make a very important point. We've got the legislative and the policy context. Probably uniquely in Wales, we have that. It's really about all key partners coming together, really pushing that collaborative approach and building on the momentum there. And the case studies have given us some very powerful examples of that. Jo, Sarah, what's your thinking then in terms of the blockers and the enablers?
Thanks, Jan. And actually, I think the main thing that you just touched on is that I think that there is a sense of frustration sometimes when people have been working on this for a little while, because we do have the framework, the context with future gens and all of these strategies and objectives that should, in theory, give us the foundation to deliver this sort of stuff together and effectively in an integrated way. So why is it not happening? And that's a question that I've had many conversations with the folks in Welsh NHS Confed. There is a subgroup where we talk about health inequalities there. Huge number of fantastic organisations across the sector that you might not think are directly linked, but we all have that same question. Why is it not happening? Why is it not translating from the principle and the narrative into the reality? Yeah. And I think we need to unpick and explore that a little bit, because I feel that if it's going to happen anywhere, surely Wales should be able to do that. So I think there are organisational boundaries and barriers almost, as Jo said, and sometimes those are real and sometimes they're perceived. So I think there is a culture and perception thing. And I think the shared language and shared objectives and things like that, because if you look at the objectives and the drivers for various organisations and parts of the sector, some of those, there are tensions there, so they can't fulfil everything. So I think, is it a priority? And are we making it easier for people to make it a priority and therefore to translate through the culture and through the processes? But it's the question, I think, when it comes to housing and health is, why is it not working yet?
Yes, thank you. And it might be, sadly, that the burning platform is now burning to such a level that it is the catalyst that actually shifts the investment, shifts the thinking. So, Ross, final point from you on this question around barriers and enablers, please.
Yeah, thanks, Jan. Perfect question. I think I should point out as well, the questions come from one of our campaign partners, so I'm not sure if it's been thrown in to test me. Nonetheless, blockers, perhaps unsurprisingly, in my view, protection over purse strings. That's an observation, not necessarily a criticism. There is a lot of protection over purse strings in certain budgets. Already mentioned by Sarah and Joe, silos. There's a lot of firefighting going on. We respond to the here and now, and what we're about to face in the next 6-12 months, or even we look back at what we could improve. The enablers thereafter are the complete opposite. So breaking down those barriers. Joe has already talked about partnership working, strategic invest to save programs. So when you think about the Future Gens framework, we're talking about a Wales of 2040, 2050, 2060. What do we want Wales to look like in sort of 20, 30, 40 years time? And we've also talked today about good practice. How do we ensure that, so an enabler of that is ensuring that that good practice is cooked in, it's baked in, it becomes concrete. And that good practice isn't just good practice in 1 or 2 organisations or certain parts of Wales. That good practice becomes business as usual. And I think that I know the Minister for Housing is on record for saying that good practice just doesn't travel that well in Wales. We need to do much more to ensure that good practice does travel and does become business as usual. So it's a vision for the future, and it's absolutely about investing now to save in the future.
Thank you, Ross. Do we have Alison Humes with us? Alison, you put something very important in the chat bar around the rights of gypsies and travellers. Would you like to join the conversation? No, but perhaps Alison's not able to stay with us, but I hope everyone can read the issue that she's raised around the rights of gypsies and travellers and what's happening in respect of that community. From the Public Health Wales perspective, Samina hasn't been able to remain with us, as you know. I will take that question back to her in terms of how we've highlighted the impacts on gypsies and travellers as part of the overarching work we do in assembling evidence, advising government on what's happening and the implications. But I'll ask Samina that specific question, Alison, if you just haven't been able to join us, and then we'll make sure we get a response to you. Now, I think we've had something in from Gareth Morgan, is that right? Gareth, you were asking around the fact that we are having extreme weather currently. It's obviously extreme weather, which is, heat related, not cold weather and winter related. But you were asking if there's anything that can be done now in terms of mitigating what we know will be the winter temperatures, and what can we do now in terms of planning for winter. Coming back to the point that we were making at the very start of the questioning, that what happens if people find themselves unable to put their heating on? What else can be happening now? So, Joe, shall I come back to you on that point? I mean, we do talk about, sort of preparing well for winter. What messages from you on that point?
Yeah, and ourselves at Valleys to Coast, and I know that a number of RSLs across Wales are talking around the green armies, we're calling, part of our sustainability agenda and education piece in terms of going out, speaking with our customers and tenants about how, in terms of trying to heat homes in a more affordable way, in terms of rooms. We're recognising we need much more energy efficient mechanisms. That's going to be a longer term solution, but there are things that we can start educating to try and reduce some of that impact and the burden of those increased costs. So those kind of engagement networks are happening across the sector.
Yeah, thank you, Jo. Ross, from your perspective then, preparing for the winter now, what's the key thing?
Interestingly, that's actually a very good question. We, Type Out, hosted a session just a couple of weeks back on tackling poverty and the cost of living crisis among housing providers. And Citizens Advice came along to give some feedback. Needless to say, their services are under the cosh at the moment. That the number of people at the door of Citizens Advice has really increased significantly, and will continue to do so over the next sort of 6-12 months as well. And together among the sort of social sector as well, there is a campaign to claim what you're owed. There is unfortunately a great deal of stigma around claiming benefits. That shouldn't ever be the case. So I would absolutely encourage anybody to seek out what they're owed in terms of supporting their fuel efficiency going forward. Again, going back to the Welsh Housing Quality Standards, fuel efficiency, as Jo has already mentioned, and heating and fuel are a fundamental part of what homes need to look like in the future. So it's absolutely cooked into the framework. It's out for consultation at the moment. So I think that's a key part of it as well. Again, solutions for today, really difficult, but we absolutely need to look forward as well. But the cost of living crisis is the here and now. And this is where I think we all need to try and support people as much as we can.
Thank you. Sarah, a comment from you?
Yeah, I think all of us wish we had the answer, to be honest, to the here and now. And as a panelist, everyone would be like, oh, I don't know what we can do. But as others have said, the long-term stuff is difficult, but we're up for it. The decarbonisation, the education, all of that is no good to people in 6 months' time. I thought what was interesting is the last few days, couple of weeks, I don't know if everyone else saw people sharing tips on how to keep their home cool, hanging wet sheets up and tinfoil and all the rest of it. And I thought how interesting that now people, rushing out to buy aircon units, even though it's not helping, but it's so desperately hot in your home, and you can't sleep and everything. How interesting it is that with everyone sharing tips on how to keep their homes cool now.
Yeah.
But then in 6 months' time, we know people are thinking, okay, where's my draft excluders? And people thinking about how they can warm up past the water so they don't have to use energy, and all the tips that people exchange each year, it seems, increasingly. And when people like Matt and Lewis say, you know what, I've run out of tips to give people, I've run out of advice to give people, people are claiming everything that they're entitled to, more or less. They are on the right tariff for them as best they can. They have all the information, more or less, and there's nothing more we can do. And I do wonder that the burning platform, Jan, does bring to mind that things, we are running out of the usual advice and tips that we can give people, and we're going from one extreme to the other. So I don't have the answer either, and I wish someone did.
Thank you. Well, Gareth Morgan, who posed this question, Gareth, you've been able to join us. Croeso mawr. Would you like to come in on this conversation, please?
Yes, be delighted to, Chair, and probably find myself in the luxurious position of agreeing with all the previous comments. The critical thing that we're looking forward to in 3-4 months' time, October, November time, is we're going to see winter pressures. We see them every year in the NHS, but this year could be particularly bad. Lots of reasons for that. Cost of living could just be that tipping point. And everything that's been said already about the heat or eat dilemmas, and totally agree with all of those points. And we know that health and wealth are correlated. So where you see difficulties in income or wealth, if you like, then that has inevitable effects on health. Really, the encouragement from myself, and I'm sort of speaking from an NHS perspective, is for NHS really to start baselining what they're doing now on housing. Because there is some good practice across Wales, but it's patchy, it's variable. We've got some good stuff here in Hywel Dda, and I know other health boards as well. So it's probably a baseline assessment that could be done over the summer months in terms of what's happening with housing, and then to try and build as many referral pathways between housing and health as possible as we go into the winter. that should mitigate some of the pressures in the short term. We need a longer term programme for that. But just finally, Chair, offering to work with any colleagues from health boards across Wales and partners in other sectors that want to do that. That's part of my good practice guide.
Thank you. Diolch, Gareth. Well, I'm just going to take 2 more questions before we close. But before I do, Samina has just emailed me because I just asked her what we had on gypsies and travellers. And she's just advised me that there is the Welsh Government enabling gypsies, Roma and travellers plan. This does include a commitment for health needs assessment in local areas to inform local health service plans, and we have work underway to look at access to services for travelling communities. So Public Health Wales will be working with our local public health teams on that. But Samina's just been able to give me that overarching piece of intelligence, and we will come back with some further information on this. So we've had a question in from Ruth Power, Ruth, and you're asking about what cross-sector leadership do we need at a pan-Wales level to drive this really urgent agenda? So Sarah, shall I come back to you on that? What is in place currently and what more needs to be done? Because, you know, there's been a very, very strong message about the need for the momentum around strategic partnerships here. What more can leaders do at an all-Wales level?
Thanks, Jan. And yes, we've gone from talking about best practice and on the ground all the way up to the strategic and the leadership level. And I think it shows you need both. It needs to come from the top as well as be informed from what's happening on the ground. So the obvious, of course, is the RPBs. And I think it's going to be really interesting to see how Wales's RPBs can really take the opportunity of the new refreshed integrated funds and involve all of those parties that can inform and contribute at an early point in the conversation as they shape those plans over the next few years. And of course, part of the point of those is to mainstream some of the best practice and the pilots and so on, which is what we want and what we need to do, as we talked about earlier. So I think it's leaders making and it is so difficult at the moment. You know, everyone's firefighting. There are fires everywhere, it seems, and it doesn't leave a lot of space to think and to work on things, not in things. But all leaders, whether they're in health, housing, social care, whatever their umbrella is, to consider, are we doing enough to look outside of that silos and to challenge any perceptions, assumptions or protections that may be there, quite understandably. But I think it's that leadership and that challenge, internal and external challenge, is going to be what shifts this on a bit. Thank you.
Yeah. Dear Sarah. Ross, your quick thoughts on the leadership challenge and really how to take it forward.
Yeah, challenge is absolutely the right word. I think I go back to my previous answer, which is around vision. So if we look forward to 2050, 2060, and we work our way backwards, that's going to require quite a degree of political and cross-sector partnership working. That's absolutely key. What can be delivered over the next 30 or 40 years? What does housing look like in 2050, 2060? And I come back again to the right to adequate housing and the piece of legislation. Lots of people think legislation is a stick with which we can beat people and to force people to do things that perhaps they don't want to do. When you think about it, a significant number of RSL chief executives have signed up to back the bill. They absolutely believe in the legislation, because the legislation is not a stick with which to beat you. It's far more a carrot than a stick. And in actual fact, it holds ministers to account to provide those maximum available resources. So if we are to introduce the right to adequate housing, for example, it forces Welsh Government to provide resource. It provides resource right to the front line. So we're building those houses in the right places, appropriate housing and appropriate accommodation so that it meets people's needs. I think that's really, really important. But ultimately, what sits at the bottom of this, or the top of it, however way you see it, is a vision. It's a vision of what we want housing to look like in 30 years' time.
Thank you. And Joe, final word to you on that then, from as a leader in this field.
Yeah, great. Thank you, Jan. And I think, you know, your question back was what's already in place and kind of what's missing. And we do have the legislation, we have RPBs, and you know, in my former role working with Social Care Wales was really behind the implementation of the Social Services and Wellbeing Act and wanting to show how RPBs and housing having a seat around the table. But then moving to, you know, being in a much more local area and a leader in the local area can recognise there are things missing out of those normal formal governance networks, because they can constrain you as well around, they provide lots of opportunities, as Sarah's already outlined, but they can constrain you. And just want to give a flavour of what we're doing in Bridgend. So in Bridgend, we have that the leaders from the health, from police, from third sector, and it's not to replicate the RPB work or the public service board work, but for us to really start strategically think differently, but also as what Ross was mentioning previously, is about how do we align our strategic priorities? Yeah. What is it that we're doing that we recognise if we align, we can do, you know, bigger bangs for our buck and really understanding. But you know, those conversations only tend to happen when you're out to those more formal governance, and that's something that we've been doing in Bridgend to try and work through, you know, terms it are to the possible and getting the buy-in and the willingness. So I think there's a bit of a top-down approach, but also there needs to be that bottom-up approach as well from local leadership.
Thank you, Joe. Well, sadly, we need to bring the webinar to a close now. We could go on with this very, very important subject, and we're going to have to turn to the email exchanges in respect of the planning system, etc., to actually see how we might improve there. So we've had a really, really rich webinar this morning with our expert speakers. We've covered a lot of ground in terms of the absolutely vital connection between housing and health, and how the pandemic, how the cost of living crisis is exacerbating inequities and really fundamental issues for the housing of the people across Wales that were already in place before we went into COVID-19. So the platform is burning now, as we've discussed. We will pull the themes together, as I've said, even though we won't be reporting formally. The recording will be available for the next week. We will respond to those questions outstanding in the chat bar, and then Nesta will be pulling together messaging into government from what has been a really rich, insightful webinar. So diolch yn fawr iawn I ein trefnir, ein cyflwynwyr ac I chi gyd am ddod ac ein cyfraniadau. So we say thank you to our organisers, to our expert presenters, to Sarah, to Ross and to Joe, diolch yn fawr iawn eto, and to all of you for coming and joining us this morning and for your very valuable contributions. Diolch yn fawr iawn. So cymerwch ofal a hwyl am nawr. So please take care and goodbye for now. Hwyl fawr.
Diolch yn fawr, hwyl.